Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. The Centers for Disease Control says that nearly 1 out of every 8 Americans is affected by asthma. That's well over 20 million people. Asthma is not only widespread, it's also one of the toughest chronic diseases to control, especially in underserved communities in big cities. Brooklyn's African American community is possibly the hardest hit in all of New York. Healthbeat's Jenny Passe Rodriguez tells us about a program designed to help both the asthma sufferers and the health professionals who want to treat them.
Deep breath in and blast out. Keep going, keep going, keep. You see how you double pumping? You can't double pump. You can't double pump like this. This is one breath, one continuous breath.
It's a cognitive effort that you have to breathe in all the way, full force vital capacity. You have to breathe in all the way and blast out as much as you can. And with asthmatic patients, it's difficult because they have the small airways collapse. So when they blast out, they feel the need to take a deep breath, and then the exam is spoiled.
Keep going.
Greg Robinson was one of about 30 health professionals conducting free asthma screenings at Evening Star Baptist Church in Bedford-Stuyvesant.
That was good. That is how it was done.
Before they opened the church to the community, they sat in on a workshop about how to address the disproportionate rate of asthma among blacks.
This is very important. Asthma care is long-term. We do not have a cure.
Asthma awareness in a church? It's the latest outreach effort of health education programs like the Atlanta-based Not One More Life.
This church and most inner city churches, their mission is not just the people that sit in the pews here, but the surrounding community, okay? And you need to tap into that.
Dr. Leroy Graham. I'm a pediatric lung specialist from Atlanta, Georgia, and I'm the founder and medical director of Not One More Life, an organization of healthcare providers and lay people who work with communities of faith to increase the awareness about asthma. And what our program does is our program provides usually a short lecture explaining asthma and other lung diseases. Then we screen participants both by looking at their symptoms and looking at their objective lung function. After we get that data, then we have them sit down and be counseled with a physician. We generate a report. That report they can take themselves back to their primary care doctor.
Here at Evening Star Baptist Church, we try to do a lot of community outreach. When we heard that Dr. Graham was coming into Brooklyn and l.i.u. reached out to us to say, hey, would you be interested in hosting this? We said sure, because as a church, that's what we're supposed to do.
The Brenda Pillars Asthma Education Program is a community outreach program to help individuals control their asthma. We chose to partner with the Not One More Life program is because we know there are tremendous disparities in healthcare surrounding the issue of asthma and predominantly in minority communities.
I think it's very important to realize that the need is greatest in our minority and our lower socioeconomic communities. Oftentimes people of color, minorities, and people of lower socioeconomic status don't look at healthcare in terms of a preventive. They go to the doctor when they're sick, and they don't take enough time to learn and go to the doctor to keep from getting sick.
We've got some very unique communities in New York.
Dr. Graham has done a wonderful job in developing a model that we're now going to try to expand beyond the black community. Obviously, the black community is very tied into their religions and to their churches and ministries, and that's a great way to start this process. But now we want to try to think about how to expand it to other communities, because thinking about living in New York, we live in a melting pot, and we do have many, many communities with similar problems.
Like seal, blast it out. Keep blowing, keep blowing, keep blowing, keep blowing, keep blowing, keep going until you stop. Keep going, keep going, keep going, keep going. Inhale.
My name is Noreen Crossland, and I was diagnosed with asthma as of past Wednesday. Today, I thought it would be beneficial if I came out to learn more about it from this program. Walking up the hill in the morning, I have like 9 blocks, and it's a hill. So when I would get up the hill, I'm like, so I told my doctor, and he did give me Avir, and he gave me a pump.
55-year-old Mary Webb has been suffering from asthma for most of her life and knows what it's like to have severe flare-ups. She attended the screening to find out about additional treatments and resources. but was having such a hard time with the screening that she had to resort to her pump.
It's very chronic. It's gotten to the point where I'm not sleeping anymore. I'm constantly in and out of the hospital on a yearly basis, 2 to 3 times a year. I've had home attendants. I've had oxygen. Each time I come to the hospital is 10 days or more. And so it's really affected my life in a negative way.
The strength of the Not One More Life program is after the actual event ends, there's follow-up. So the Brenda Pillar's Asthma Education Program will be following up with these individuals at 1 month, 3 months, 6 months, and a year afterwards. So if they were advised to see their primary care provider and they had difficulty in the process, at 1 month we can figure out what those issues are, we can give them some reference material and help them get into help them meet with a provider.
The first pump that I received was the Healthbeat.
To get in touch with Not One More Life so they can visit your house of worship, visit notonemorelife.org. For Healthbeat Brooklyn, I'm Jenny Passe Rodriguez.
And that's right. Now, what you're not taking yet.
Become a fan on Facebook, like Brooklyn Independent Television.